Welcome to the press briefing today. The two panelists are Dr. Chong Shuk Kwan, Head Communicable Disease Branch, Center for Health Protection, and Dr. Larry Lee, Chief Manager, Hospital Authority. Perhaps we will hand over the floor to Dr. Chong to give you an update on the latest situation. Good afternoon. We had 16 confirmed cases, and 7 of them are local cases, and 9 are imported cases. 12 are Omicron variant carriers N501Y plus T478Cal, and the other one is a carrier of L452R variant. And the investigation is going on for the other cases. There are 7 local cases, 2 of which are untraceable, and 5 are epidemiologically linked with other cases. Well, first, on linked cases. 13073 is a 73-year-old male, and he's a family member of 13095, and the person has visited Little Boss. And this carrier, it is a carrier of L452R. We are conducting the whole genome sequencing analysis, and both of them live in of Kah Lung Court, Kah Sing House, and they have visited a Star Seafood restaurant in Aberdeen. And then 2 cases live in Unit 104 of Tung Mun House is 13074 and 13075, and 42-year-old female with her child 3 years old. And for Tung Mun House, for Unit 14, all the residents have to be evacuated, and 23 residents in 8 units have been evacuated. We have conducted investigation in environmental samples which have tested positive. These include a sample taken in the drain outlet of the flat underneath, and also the part beneath the basin, the washing basin, and also at the exhaust fan. And then 13079, who is the classmate of 13069, and they are both in M3 class, and on the 14th of January they took the exam on the school. They didn't have direct contact. They knew about each other. They were in the same classroom, and because of this, the teachers and the students in that classroom have to be quarantined. We're talking about 30 people or so. And then another case, 13084. Previously, we said that the case was detected on the 26th day, and he was living in the unit below the infected unit in Tung Mun House. The whole family was infected, and they lived in room 1206 in Silka Seaview Hotel. And when they returned to the flat, they stayed home most of the time, apart from going out for the tests. And then there are 2 cases which are untraceable. Yesterday, I mentioned about this, and the person lives in phase 3 of Mei Fu Sunshine, and she teach in Learning Habit Kindergarten, Novum East. And she carries N501Y and T478K, an Omicron case. And we are still investigating into whether she has contacts with students or what, so that it will take some time for us to get to the bottom of the matter. And her friend, who had dined with her, it's a close contact, 28-year-old male, is a preliminary positive case. And then another case, which is untraceable, is a male, 79 years old, and he lives in Yat Kwai House in Kwai Chung Estate, and he's not feeling that well, so he stayed while he lingers around in the park in the vicinity, and he didn't wear the mask properly because he suffered from shortness of breath. So this is an untraceable case. How did we detect him? Because he went to Yan Chai Hospital to get a colonoscopy test, and there was a screening test for him. So this is a positive case. And starting on the 18th of January, he suffered from shortness of breath. and he would order delivery for meals, and he would eat in the park. And he went to Taiwan House wet market, and also on the 8th of January, he got his identity card changed at the Chinwan venue. And then another person living in a Yet Kwai house, which is a preliminary positive case. I'll talk about that in a minute. Well, they don't live in the unit with the same orientation, and they don't live on the same floor. So on an initial basis, there are around 10 or so preliminary positive cases. And these include, or at least 10 cases, local cases. And some of them are not traceable either. And one of them lives in Kwun Tong Hoi Wui, Phase 3, and he's a 17-year-old student. While he studies in St. Joseph College in number 46 of New Clearwater Bay Road, is an untraceable case. And on the 15th, he started to have a fever. And then on the 17th, he consulted a doctor. And then after submitting a sample, this is a preliminary positive case. He has not been subject to compulsory testing. He hasn't been any high-risk areas. And he didn't visit little bars, and he didn't have any contact with Hamster. And preliminary, he is a L452R carrier. He might be a Delta carrier, and he might be related to the little bars cluster. Now this person on the 16th visited a Japanese restaurant at around 1:30, and on the 15th he visited Mongkok Center and another shopping mall. At other times he went to school, and on the 14th of January he went to Lok Fu shopping mall. And on the 12th of January, and he dined at the Fiesta Thai restaurant at 8 p.m. So we still have to further ascertain his source of infection. For another case, which is a preliminary positive case, and he works in the airport at the freight handling center. His employer is an outsourced contractor of Cathay, and he worked in the 5th floor of the cargo center, and he was driving this cargo vehicle, and didn't have to come into contact directly with the cargoes. He received orders, and then he delivered the goods here and there. He went to work by himself, and he was always on the same vehicle. On the 18th of January, he started to have coughing, and he tested positive on that day as well. And the last time he took the test was on the 12th of January. We're still investigating his case. He also lives in Kwai Chung Estate, Yet Kwai house, but on a different floor and a different unit compared to the confirmed case. But we are still ascertaining whether he had some context with the 79-year-old case. That person, that male, was staying in the park on the ground floor all the time, and we are still finding out whether they have met each other. Another preliminary positive case is 13079 related, and he lives also in Taiwan of Monterey Cove of Caribbean coast. He's 14 years old, and with a person studies in the Hong Kong M.A. Li Po Chun College in Yau Ma Tei. And the student is in Form 3. The last day of school was the 17th of January, and on the 18th he had a headache and he had coughing, and the family member was a confirmed case. So the source of infection must be his family member.
So he was on January 14, went to the mosque in Tongchong. So she went to school, and sometimes he was in another private estate in Tongchong with other friends. So we are following up on that. Another preliminary positive case. So it's a case where the sources are known. So it's a kindergarten teacher's friend. So he was found to be working for clerical work in K11 Museum, and he lives in Chunwan. And on 17th of January, he had symptoms of coughing, and he had 2 shots of BioNTech, and he was sent to the quarantine center, and samples were taken. So it's a preliminary positive case, and he usually had a breakfast at the workplace. So sometimes he went to the Changchai restaurant in Musi, and also went out for dinner with another friend in a nearby area. And then on the 15th of January, he went to the Ocean View Chinese restaurant in Tai Ao Moon, and also did some shopping in Ocean Terminal. So another preliminary positive case is in Kanfeng Court, Kem Yong House in Monshan. In the 58-year-old lady is in the Delia school's teacher in class 2E, and it should be the class that is neighboring to the 2 brothers' confirmed cases, and it's in 11 and 12 of January. She was an invigilator at the school, and 2 confirmed cases took the exam, which was invigilated by her. So we would identify all the students who took the exam as close contacts. So that teacher, other than in school, also went to a shopping mall in Sun Gongseng in Chengquan-o, in Monshan, and she also went to Chong'an Wet Market to buy food. And she consulted doctor before, and in Taiyao Street, Diamond 3, a third Taiyao Street of in Diamond Hill, and it's a Chinese doctor. And she didn't had his throat checked, but we still have testing for all the people who were present there. And also in Cameron Street on the 15th of January, it's a congee shop. She also went to Kowloon City for shopping on the 15th of January. Other times, she was just in school or in the school office. She just stayed there except being the invigilator at the exam. So she did not have close contacts with the confirmed cases the students. So another 3 cases. So they should come from the same family. So they live in Monterey Cove of Caribbean Coast, and it's 11, 14, and in the teenage years, and they study in a Buddhist secondary school, and then the other of the children study in the Lantau Island International School. So after and he stopped going to school, and on the 15th of January, he went to the home of 13079. It's also a place in Tongchong. So it's the home of the case who was in Delia school. That child had dinner at the place so it's in the Buddhist Fa Ho Memorial College. So class has been suspended in the school, and testing has to be run for the whole school. So other preliminary positive cases, I don't have further details. So maybe more information will come. So we have been seeing more untraceable cases. So we see the pandemic situation getting more serious. So there are some unidentified transmission links. So we also see the Delta variant being spread out from the Little Boss cluster, and also for the 26th day case, which is in the Samshipo area and the neighboring areas. And also, we also see a risk in the Meifu area. So I appeal to the public, if you are living near those areas, in Yunchao Street or nearby areas, you have to get tested as soon as possible. But of course, the testing would be voluntary. So if you feel unwell or feel you living in a risky area, so please take the test. We are arranging a lot of community testing centers to make it convenient for the public to get tested. So we hope to cut off the transmission links. So I hope to make it clearer for all of you to we assure you that the community testing centers are all open. So that's all for my update. So Dr. Lee, please, for HA, for the past 24 hours, we have 24 reported cases and 28 patients were discharged. Now in total we have 12,474 has been discharged. And till 9 a.m. we have still 322 in 42 patients in under our network in various facilities. So all 342 patients are in stable condition. So these are my update. So Q&A time. Please say your name and your organization. The lady on the back. Cable TV, 2 questions. First, for the Little Boss, there's a credit card transaction tracing system in place. So if they have been tracked down, but they are not willing to hand over the hamsters, will there be any consequences? For now, some hamsters may be abandoned. So how will you handle those abandoned hamsters? So now you are appealing to the public that the hamster should get tested as well, even though they're not from Little Boss. So is it for anyone who keeps hamsters, they have to have the whole family get tested, or only the keeper, the primary owner of the hamster has to be tested? Another question on Omicron, on BA.2, this particular strand. So is it all related to the Pakistan woman who got confirmed? So, of course, we have to track down each case to its own particular circumstances. And we know several staff members in Little Boss have been in touch with that confirmed patient. So, for anyone who has been in contact with that confirmed case would have to be tested, or anyone who have been visiting Little Boss in those few days have to get tested. So for hamsters, if it is the 22nd December if it is bought after this date. We are worried the hamsters that is bought after this day may carry the virus. So if the hamsters is in a family, is in a house, all the people within the family will be at risk.
B8.12, we haven't completed all the whole genome sequencing analysis. We believe that this may be related to the case detected on the 26th day. But we haven't completed all the sequencing analysis yet, but there are 10 or so related cases. The next question. Well, the journalist in black next to her. Dr. Zhang, I'm from TVB. My question is about the hamsters. From what you understand, how many hamsters have been sold at Little Boss and other pet shops around Hong Kong? Do all the consignments come from the Netherlands? Are they supplied from the same supplier or the same place? And for other hamsters, do they carry the same high risk as those in Little Boss, and that they have to be treated correspondingly? And then a question on the Delia Memorial School case. You said that there might be infection during exams, but then all of the students must have worn face masks, right? How come that, well, even face masks are being worn and there's still the infection? And then around about B8.2, if there are a dozen or so cases, will the authorities be able to ascertain the level of risk related to this strain? For those who have taken the vaccines and those who haven't taken the vaccines, will the death rate or the casualty level be very high? Now, as to whether all the hamsters come from the Netherlands, I don't have any information. But I know that for the two consignments shipped on the December the 22nd and the January 7th in the warehouse, they all come from the Netherlands. But as to whether there are other sources of hamsters, I am not in the know. Now, as for the Delia Memorial School, we also find it quite odd. Generally, during exams, you wouldn't talk to anyone. You wouldn't move around and have contacts with other people. Well, for the previous waves of outbreak, well, we didn't see any such transmission. But then the situation may be different nowadays. And I wonder whether there might be sort of super spreader or what among them. So for the two exam sessions, we saw that there was transmission. So for prudence sake, we consider that all the people there have been exposed and they have to be quarantined. Now, for now, it's difficult for us to tell you about whether BA.2 is particularly transmissible. There might be many factors behind transmission. There might be super spreaders, and other factors may also come into play when it comes to the transmission level. And this is so very common in COVID-19 transmission. While the gentleman on the right, on the other side, well, I'm from Now TV. Good afternoon. First, I would like to follow up on the issue of hamsters. Now, for Little Boss, for the samples taken of hamsters there, have there been more positive cases? And for the samples collected at warehouse, are there more positive cases? And what about the other outlets of Little Boss? Have you been detecting positive cases? And how many animals have been put down so far? And what about the genome sequencing for hamsters? How is the progress on that side? And what about the matching of the genome sequencing of the staff and hamsters? Would you be able to ascertain the source? Now, the next question is on the school. Dr. Zhong mentioned that a number of schools have seen students being confirmed. So do you think there is a need to suspend classes early? And for the Delia Memorial School, for the kindergarten teacher living in Meifu Sanchun Phase 3, is she related to the Delia cluster? And for the Yanchai Hospital case, would you be able to tell whether there is transmission within the hospital? You said that a tenant living on a different floor with a different orientation of the units. Is there a linkage? What is the risk level in the building? I know the AFCD colleagues are working on the environmental sample testing, and the lab is working on the whole genome sequencing analysis. I don't have any specific information to share. I know that this is going on. Now, as for suspension of classes, I believe that the relevant authorities will be keeping close tabs on the situation, and they will consider a number of factors in making the decision. And they will make announcement as early as possible. We are still investigating into the case of the kindergarten teacher. Well, her residence is quite close to the school, so we will be also probing along that direction. And we will also be looking at the genome sequencing analysis to find out more. The kindergarten teacher is an Omicron carrier, or is a suspected Omicron carrier, so we are unable to tell as of now. As for the Yanchai Hospital case, he lives in the same building as the other case, but is not like the other cases where there is a vertical transmission. They live in the same building. Maybe the two cases have met downstairs or what, we don't know. We have to further investigate. Now let me provide more information relating to the Yanchai Hospital case. The 79-year-old gentleman is an untraceable case. Yesterday morning, he was admitted to the hospital for colonoscopy examination. He got a negative test result 72 hours previously, and we are actually requiring a 48-hour test. And we have considered the fact that we don't want to delay his examination, hence we allowed him to do the exam. And we think that the patient is of a lower risk, and we didn't detect any linkage with any cases between the patient and the other cases. So we did the examination. Two more things. Well, we did the colonoscopy in a negative pressure surgical theater. We also tested again for COVID-19 virus. And then we found that he's a preliminary positive case, and we started our procedures right away. In terms of our contact tracing, 2 colleagues, 1 doctor, 1 nurse, and also a patient are considered close contacts. And then different tests are being carried out on 37 patients and 1 visitor and 14 colleagues. And we also collected 50 environmental samples which tested negative. And we are still following up on the case. I've mentioned what the kind of tests that have been conducted in the hospital. The next question, an English question, please. The journalist on the left.
Questions from our THK. The first one is for Delia Memorial School. Would you describe it as a super spreading event, and why? Does CHP advise suspension of all secondary schools? And also, second question is, do you think the outbreak is getting out of control as there are more unlinked cases? Thank you.
I cannot say that the Delia Memorial School is a super spreading event at the moment, but the 2 classes did have spreading events, transmission events in the class. So we need to be certain how many teachers and students are affected before we can conclude whether there's a super spreading event. But at least there's some transmission occurring. And we are indeed very worried about the increasing number of unknown cases in the community. And with Delta in some cases, and Omicron in the other cases. So, and there are signs that there are still cases coming up from the community testing centers. So we urge the public to be vigilant about the hand hygiene, avoid social activities as much as possible, and go get testing if you live surrounding those residences, and follow all the compulsory testing notice. So for residents who or those who work near Untraceable, Yunzhou Street, or those stay near Meifu, please go test as soon as possible. I think this will be closely monitored by the government.
下一題，前邊紅色衫嗰位。
Next question in red shirt. So in Meifu and Shamshui-Po, now there's an outbreak. So will you consider to have a more stringent compulsory testing exercise in those areas? So far in all the confirmed cases we have, we know the BA.2 and BA.1 strands of Omicron and the Delta cases. How big of a proportion are they taking up out of all the confirmed cases? So we are now just try to track down the places that the confirmed patients have been, to have compulsory testing along all those places. For example, they have been in schools or in their own buildings they live in. So we believe that these are effective means to identify the cases by compulsory testing. But we also see that there are some untraceable cases in Shamshui-Po and the Meifu areas. So, like in Meifu, for example, maybe there are some transmission links that are hidden from us. So we really urge the public who live around those areas to sign up for voluntary testing, because they're for free. Or if you have been to any of those high-risk areas, or if you've been near those areas, you can get tested as well. And for Delta cases, so out of all the confirmed cases we have, should be some 3 to 4 related to the Delta variant. So it's, for example, the staff member in the restaurant and their family member. And we know also there's the L452R strand, but there are still some suspected cases. For BA.1 or 2 strands, we believe it comes from the Tongmun House family, and also in the Yunzhou Street family. And another source may be the Delia Memorial School. But we have to wait for the genome sequencing to have the final confirmation. And for the other case who was in Causeway Bay having meals or dance classes, we still await further information about that case. The lady on the back at the left, HAO1. I want to ask about the Grand Central preliminary positive case. It should be a Delta case. So how is it linked to the Little Boss cluster? Is there already some hidden transmission links in the community? And any results from the testing for the animals in Little Boss? And how many of the hamsters have been terminated, their lives are terminated. So about the Delia Memorial School, so is the total of confirmed cases, is it 4 cases there? So is there an outbreak in that school? And we have been seeing more secondary schools having confirmed cases. is there a need for suspension of classes for all secondary schools? Is in St. Joseph Secondary School, it is Delta case, is the L452R strand. For now, we don't see any epidemiological link between these Delta cases and other Delta cases, but we would continue to see if there are any further links between them. And for the animals testing, I don't have the number of confirmed or the results for the animal testing with me, but for the Little Boss customers, we can do credit card tracing. So a total of 140 or 50 customers have been identified and they have to get tested. But for some cash transactions, we may have missed them. So we need those people to turn out to get tested. If you have been there to buy hamsters and to do anything there, please come forward and get tested. We would see if you are in any way linked with the confirmed patient from Little Boss or any confirmed cases of hamsters. We know in Little Boss, many people go in and out, and we are not sure whether the hamsters within Little Boss are actually the source for the virus. But we would assume for now it's still human-to-human transmissions. So the key is to find out that around 150 customers who have been to the shop. For now, this is the focus for us. And if any of those cases are left out in the community, there is risks with those people. And for Delia Memorial School, 3 students, 1 teacher, confirmed cases from there. So a total is 4. Next question. Gentleman on the left. RTHK. About the hamsters. So some vets have appealed to the public that they should not sell any more hamsters after the date of 24th of December. So are there any scrutiny on these recommendations? So for the Delia Memorial School should be 1 preliminary positive teacher and 3 confirmed cases of students. What you mentioned is not the requirement of the CHP. AM 730 in the Kwai Chung Fai terminal, did they take the bus E32 together with another confirmed case? And for the 79-year-old confirmed case, do you have the CT value for that case? And did he wear the mask properly? So is the shortness of breath related to COVID, or is actually his own condition? So for that case, do they share the elevators with anyone? And for the teacher, you said there are around 5 to 10 classes. They have to all get tested. So what classes did she teach? Is this just class 2E or also some class in Form 3 as well? And is Tuen Mun no longer a high-risk area on top of the current high-risk areas of Sham Shui Po? And you mentioned about 3 high-risk restaurants. So have you found other people related to the 3 restaurants thus far? For the bus, I need further updates. And for elevators, I don't think it's related because there are many elevators in that building and they go to different floors. So I believe elevator is not the source for now, but I would have further confirmation on that. For that, she was only a vigilator for class 2E, but not other classes I can confirm. And for other cases you mentioned, I don't have further information. And for as a teacher from Learning Habitat Kindergarten, I have to see whether they take off their masks in between to have tea, to have snacks, for example.
冇再見
For now, we don't detect any further cases. But it's difficult to say because there is an incubation period. Maybe cases are still not identified. Let me supplement the case on the Yanchai Hospital. The CT value is around 20. Well, the person has certain medical background. He has chronic respiratory diseases, and his shortness of breath is a result of his own underlying condition. The next question, the lady at the back row there.
From SCMP. So like how many hamster, but not the number of hamster samples, returned a positive result? Are they all from the Causeway Bay Little Box shop? And how many % does it account for among the hamsters in the Causeway Bay shop and also in the or in the typo warehouse? And second, how's the genetic sequence result of the hamsters and the pet shop staff? And third, like how many Little Box customers were traced so far? And how many people have given up their hamsters? Thank you.
I do not have details on the updated figures for the animal testing. That is carried out by the Agriculture and Fishery AFCD department. But we did some environmental sample on the two shops. So let me check. So for the typo warehouse, we collected 51 environmental samples from the cages, and 13 of them were tested positive. And for the Causeway Bay, we collected 29 environmental samples, and 5 were tested positive.
下一題。後面
The next question, the gentleman at the back. I'm from Ingpao. First, about the pet cluster. 13047, the shop assistant, and also the customer, the female customer, and her family members. Do you have the results of the genome sequencing? You said previously that there is a preliminary positive case. So I would like to find out more about the situation in the family. And then secondly, you said that at Typo Warehouse, a number of staff members have been put to quarantine and they have to be tested. Are there new cases arising out of that group? And Dr. Chong also talked about the situation at Typo Warehouse. For the environmental samples, where were they collected? Which locations? The samples from which locations tested positive? And what is the source of transmission? Do you have a better idea of whether it's human to animal transmission or otherwise? Now, Little Boss, you said that you haven't been able to track down some customers. How many customers have not been tracked down? And then for the new cases, first about Delia Memorial School, I would like to seek clarification. You said that there were 2 exam sessions. How many teachers and students were involved? And were there 2 exam sessions or were there many exam sessions? And you said that for exam sessions invigilated by the teacher, the students therein should also be tested or quarantined. So how many are you talking about in total? And for the forklift driver case, do you think that he got infected from the cargo or elsewhere? And he is a L452R case. How many of his co-workers have to be quarantined? And then the last question on Tongwon House. According to the genome sequencing results, for the 2 new cases today, for the 614 and 615 cases, are they related? Have you confirmed that this is a case of a vertical transmission? for the 13047 customer who went to the went to shop at the little bars, and his family member is also a L452R carrier. The genome sequencing results have not been out yet. And then for the typo warehouse, there are 30 or so co-workers. We are still tracing the customers. We have to get to the details and the specifics of each case, who actually made the purchases, and so on, who came into contact, and so on. And a dozen or so don't come with any telephone number. They pay by cash. So we'll have to work out ways to track them down. And for the two exam sessions, they were held on the same day, on the 14th, in 2 classrooms. And the exam period was more or less at the same time. And around 30 or so students were in 1 session. I don't have this exact number. As for the forklift driver, he didn't have to get in touch with the goods, and he didn't even have to touch the cargo. So we'll have to investigate whether he got infected from the airport or from the community, because there seems to be another resident in the same building he lives in who got infected. And we don't have the results of the genome sequencing results of the Tongmun House residents. And because they live on the different floors in the same building, it seems that they are linked. But, well, we still have to wait for the genome sequencing results. The next one, the lady over there, Hong Kong Economic Times. For the Untraceable case, the teacher of learning habit kindergarten, and she had meal with somebody. Which restaurant and which date? And for the preliminary positive case, have the cases been vaccinated? What is the CT value? How many close contacts have been involved? And for the case in Grand Central, the person have to be quarantined for 21 days because it seems to be an L452R. Have you got the details for the forklift driver? Like the age and so on, and what places did he visit in the airport? And for the Tung Chung family, they went to the mosque in Tung Chung. For how long did they stay in the mosque? Have they had meals? Do people from the mosque have to be quarantined? And for the exam sessions, for the 2 students infected, were they far apart? Did they go to the toilet at the same time? How was the ventilation like at the exam venues? And then if the hamster owners didn't hand over their hamsters, would the CHB be able to advise them on things to watch out for when dealing with the hamsters? And then there is a case of, in your notice saying that there is an overseas case staying in Hong Kong. Do you have the details? L452R Delta, well, the requirement is still 14 days quarantine. Going by the previous cases, if there is a case which is confirmed beyond the 14 days, well, it's most likely a repositive case. So we are still sticking to the 14-day quarantine rule. The airport worker is 53 years old, and the family stayed in the mosque for 25 minutes to pray. There was no other activity. And for the seats, we are still investigating. As for the situation involving hamsters, how do pet owners protect themselves? I think I'll defer it to the AFCD experts to make the advice. Well, the most important thing is not to abandon the hamsters, because if you dump them on the streets, well, you will create more problems. Sorry, the speaker is not coming through. The CT value. For the 17-year-old boy, the CT value is 8 to 17, rather low. So we'll look at the CT value again when he's really confirmed. As for the airport freight forwarding center worker, the CT value is 19 to 21. The 14-year-old are studying in Lee Kwok Po Secondary School. The CT value is 25.8. And then 13072, the friends of this case, is CT 38.2. The Delia teacher is 23 to 25. The ones studying in Lantau International School and the family members, the CT is 26 to 27. I don't have the CT value for the 2 other persons. Sorry, the speaker's not coming through.
觀察下先知。
We would await further clinical observation at hospitals. If there are no any further questions, I'm sorry, I don't have further information with me now. But usually, if they went overseas for a short period of time and then they come back to Hong Kong, they would still need to get tested by way of compulsory testing. Sorry, speaker is off mic. They have been to the one, a place called Odelays, as I remember, it should be pronounced that way. And they have been to Harbour City, and for the one in Odelays, is the 15th of January, and for lunch, and then at night time, the same date is in Harbour City. This is the end of the press briefing. Thank you.